Total knee replacement can be a stressful operation, and one of the things that many patients worry about is going home after surgery. So stick around and hear more about whether or not you should go home or whether or not you should go to a rehab facility. Hello and welcome back. I'm Adam Rosen, and thanks again for tuning in. If you could take a moment right now and click the thumbs up button if you enjoy this content and subscribe so you get updates when these videos come out. It does really help the channel. In today's video, I'm not going to talk to you about should you have a knee replacement or what is a knee replacement, but more importantly, what happens after knee replacement? Should you go home or somewhere else? Now, like many things, things change. So over the 20 years that I've been in practice, things have changed. Very frequently in the beginning of my practice, patients went to an acute rehab facility after joint replacement surgery, and this was great. Patients got 3 sessions of physical therapy a day, 7 days a week, and they did great. But for many reasons, that's not available anymore. Most patients now will go to a SNF or skilled nursing facility. It's basically a nursing home. And what I've tried to explain to many patients after knee and hip replacement surgery is that you want to go home. You're not sick, you're not ill. It's an arthritic sports injury. Get up and walk it off and try to avoid going to a skilled nursing facility. What I saw over the years, and what a lot of the data has actually proven, is that patients that went to a skilled nursing facility had increased rates of blood clots. They had increased rates of infection. In the knee replacement world, they had decreased range of motion. They had worse outcomes and longer recoveries. Now, there's a little bit of a bias there because sometimes the patients that go to nursing homes are some of the oldest, sickest patients that might not do well anyway. So there is a little bit of a bias there, and healthier patients tend to go home. But this was something that I talked to my patients about because we always talk about after therapy or after surgery that the exercise and activity is important. We want you to stand, we want you to walk. Walking decreases the risk of blood clots. We want you bending and straightening your knee, which decreases the chance for stiffness and improves your range of motion. And frequently, especially on Fridays, patients would go to nursing homes and you wouldn't be allowed out of bed until physical therapy saw you and cleared you. And that might not be until Monday. So the nurses would keep you in bed Saturday and Sunday. So when we do a surgery where the most important thing is getting up and moving, you're basically at bed rest for 48 to 72 hours. Now, I would explain all of this to my patients, and still some patients would refuse to listen to me and still go to a nursing home. And what you'll hear in some of these studies is that there's a huge prejudice from patients, their families, even some people that work in hospitals, and still some doctors that patients can't go home. And what would happen is after I would explain this, patients would go to a skilled nursing facility and they would be put into a room with a sick roommate because the nursing home is full of sick people. And they would be concerned about getting an infection. They also would be confined to bed and they would be upset feeling like they were stuck and they were almost in jail and they would want to get up and move, but the nurses told them that they can't until they were cleared by physical therapy. Sometimes doctors would alter medications. This became a big thing as we switched to aspirin, and doctors in nursing homes would then put people on heavy duty blood thinners, which could lead to bleeding, which could result into an infection or a hematoma, which is a collection of blood, which can be painful and limit motion. And on top of all of that, most nursing homes don't have pharmacies like a hospital does. So if you got there late at night, the orders for your medications would go to a pharmacy. They may not be delivered until tomorrow. So if you needed pain medication, you're not going to get it. Sometimes they have emergency stashes, but many patients weren't getting the medicines that they were needing or what was required, and patients would get angry. And I can't tell you the number of patients that left AMA against medical advice, and then they would call the on-call doctor of the service, and we would have to then rearrange getting physical therapy and medications to them at home because they spent less than 6 hours at the nursing home. Now, there are a lot of factors that sort of complicate this. And again, the prejudice of family members, the prejudice of some older doctors, nurses that work in hospitals, case managements, physical therapists will sometimes tell patients you need to go there, but you don't have to go there. There might be medical reasons to go there, but you don't necessarily have to go there just because you had a hip and knee replacement. And more frequently, patients are going home. And this has increased over the past decade. The two biggest factors that I've seen, number one was COVID. If you were having a knee or hip replacement during COVID times, all of the nursing homes were full of COVID patients and hospitals were full of COVID patients. So if patients had surgery in a hospital, their goal was to get home as quickly as possible. So that really increased the percentage of patients going home after these surgeries. And we also found that it was safe for many patients to go home. So insurance companies then changed the designation that these surgeries were technically outpatient surgeries, which meant that you could even do these in surgery centers. So many doctors that own surgery centers would then transfer their patients and do their surgery at the surgery center they owned, as opposed to the hospital that they had privileges at. Because what a lot of patients are surprised to hear is doctors make about $1,200 for doing a hip or knee replacement surgery. That includes the surgery and 90 days of care after surgery. Now, if you own a surgery center, you're going to make much more than that $1,200 for the facility fee because you own the building in the center in which the surgery is done. So many doctors have taken their patients away from hospitals to the place that they own, and that increases their profit. So you don't have to believe me, but what does the data show? So in this particular study, it asked the question, who might go to a skilled nursing facility? And it kind of makes sense as to what you might think is that if you were older, there was a greater chance that you would go to a skilled nursing facility. More frequently, women more than men are patients that go to skilled nursing facilities after joint replacement surgery, and patients that have many medical comorbidities. So if you have lots of medical problems, you might be deemed a patient that would go to a skilled nursing facility versus home. But these studies do show that patients have a higher complication rate. And study after study has shown that patients that go to nursing homes have higher complication rates. But again, can be a little biased because the sicker patients are going to go to a nursing home and the healthier patients are going to go home. So this particular study looked at hip replacements, but pretty similar again to knee replacement studies. You can have a higher readmission rate, meaning that if you go home and stay home. Um, if you go to a nursing home, there's a greater chance that you're going to have some reason that the nursing home is going to send you back to a hospital. We call it a readmission for some issue, whether or not it was from the knee or the hip or a medical complication. And you might say, well, yeah, but most patients that are having knee and hip replacement are Medicare patients. They're over the age of 65. Well, what does the data show there? The data actually shows that it is feasible and it is safe in 75% of Medicare patients to go home. And this is actually a study that looked at same-day discharge. That's a topic I'll talk about in another video, the difference of being inpatient versus outpatient versus same-day discharge. But it does show that not all patients, even Medicare patients, have to go to a skilled nursing facility. This study showed that 75% of the time it was safe for those patients to go home. Well, what about going home? Is it safe? And the simple answer is yes, for almost all patients. So, this particular study, again, looked at Medicare patients and found that it was safe for those patients to go home after joint replacement surgery. And this other study here looked at another question that a lot of people have is, well, what if I live alone? Can I go home safely? I couldn't find one study that I remember reading about in the British Orthopedic Journal, and it actually found that patients that went home and lived alone actually had better, quicker recoveries than those that went home with family members. And the assumption there is that they had to do everything for themselves. But this particular study showed that patients living alone can go home safely after joint replacement surgery. The recommendations that they made is just extend the hospital stay a little bit longer to make sure that they're doing well and make sure that they have home health services available that can help them with things that they might need help with in the first couple days. But overall, the importance of this, I just want you to understand, again, like always, what the data shows and also what I discuss with my patients. Many, many years ago, it was pretty standard and common for patients to be in the hospital 3 to 5 days and go to a nursing home for a week after surgery. And all of those things have changed as we have accelerated the rehab, we've improved pain management, anesthesia, the surgery, the outcomes, all of those things have improved. And what we have found is that when patients go home and they act normally, they use the stairs, they sleep in their own bed, they bend and straighten their knee, they eat meals at the kitchen table, they get back to a normal lifestyle as quickly as possible. This really helps in gaining range of motion. It prevents scar tissue and stiffness. The more ambulatory they are, the lower the risk of getting a blood clot. And patients seem to do better, quicker, and faster in that home environment as opposed to being in an institution where you're going to be less mobile, more sedentary, surrounded by sick patients, and then go home and be behind the eight ball from the very beginning when those that had surgery in the same day as you did are actually further along, because they've simply been walking, moving, and doing at home. So I hope this has answered some of the questions that you might have. Definitely something to always discuss with your physician, your family members, your significant other or spouse, and make sure that you make the appropriate decision for you. But this just lets you know that for the vast majority of patients, it is safe to go home after knee and hip replacement surgery. Thanks again for watching. Until next time, I'm Adam Rosen. Stay safe.